Hi, I'm Justin Silva with National EMS Institute. Today we're going to do a quick demonstration on CPR. Statistically, every 90 seconds there are individuals that suffer from cardiac arrest. So first step, arriving on scene to find your individual, immediately activate the emergency response system, being called 911 immediately. I'm going to check for responsiveness of my patient. Sir, can you hear me? You're all right? I have no response. I'll check for painful stimuli. I have none. Immediately, we're going to check for a pulse at the carotid artery. It's going to be the soft spot on either side of the trachea. I'm going to check. While I'm checking for a pulse, visualizing for rise and fall of the chest. I'm going to do so for 10 seconds. Once I verify there's no pulse, no breathing, we're going to begin chest compressions, which my partner will do. You're going to push hard, fast, forcefully at a depth of at least 2 inches for an adult victim. While he does this, I would start getting my AED set up and ready for use. Once he hits the count of 25, I'm going to get ready to ventilate my patient. Each seat grip with the bag valve mask, I'm going to pull back slightly on the head to open up the trachea. Deliver 2 rescue breaths over 1 second. Ventilate, ventilate, begin your second cycle. First step with an AED is to make sure you turn on the device once you have that. AED will walk you through what you need to be doing next. Connect electrodes. Once he finishes up, 2 rescue breaths, ventilate, ventilate, begin third cycle. We're going to connect the electrodes next, as the AED has said. Picture of the plug. They're going to show you a picture of the plug on the AED device itself. Once I plug this in, this is going to be telling me to push to analyze.
Connect electrodes.
Ventilate, ventilate, begin fourth cycle. I'm going to get my pad set up. 1 pad is going to go on the bare right upper chest, as shown on the pads itself.
20.
Once he hits 25, ventilate,
Connect
ventilate,
electrodes.
begin 5th and final cycle. Next pad is going to go on the left lateral chest, so this works in unison with the heart's conductive system. Pad placement's extremely important. Make sure you're following the pictures and the guidelines on the device.
28, 29, 30.
Finish with 2 rescue breaths. Ventilate, ventilate, since the 5th and final cycle is in. The AED is now going to tell you to push to analyze the victim. Prior to analysis, you need to make sure you clear the victim. To do so, I'm clear, you're clear, everybody's clear, and hit the analyze button and stay back.
Stand clear. Analyzing now. Stand clear.
Well, the AED charges, make sure everyone's clear. The victim stays clear all the way through the shock administration. Touch the victim while the AED is shocking, you will get defibrillated yourself. Touch the victim while it analyzes, this thing will not work correctly.
Stand clear. Push.
Prior to delivering the shock, you're going to clear your victim 1 more time. I'm clear, you're clear, everybody's clear, shocking. Shock's in. Once your shock goes in, my partner and I are immediately going to get up. We're swapping roles. We're going right back into chest compressions immediately. We're going to continue with another 5 cycles and defibrillate the patient again as needed. As far as verifying return of spontaneous circulation, if we have pulses back or not, once the AED says no shock advised, upon analysis, I'm going to recheck for a pulse in the victim and we'll continue through as needed. You do have pulses back in your victim when this says no shock advised. We're going to continue with rescue breathing on the victim. We're going to do 1 breath every 5 to 6 seconds for the adult victim.